And remember this, do you know how we transmit these pathogens from one another? There's 3 ways: mothers, lovers, and dogs. So the last thing you should be doing is letting your dog lick your face or let your dog lick off of your spoon. Believe it or not, there's people that do that.
Welcome back to another episode of the Peak Performance Life podcast. Today, I am very excited to have an expert on a very important topic that most people don't think much about when it comes to health, but it actually has profound impacts on many different aspects of your health, and that is your oral health. We have Cris Duval, RDH and founder of the Lifeguard Approach. More than just a practitioner, Cris is a catalyst for change in the world of oral health. Her approach helps dentists and hygienists save lives by shifting the focus of practitioners from calculus removal to oral systemic health. After 4 decades in patient care as a dental hygienist, Cris tragically lost her husband to a heart attack, and this devastating blow spurred her into a new direction, focusing her sights on the connection between oral and arterial health, which I'm sure we'll talk about today. Very, very important link there. Cris founded the Lifeguard Approach to be an architect of change for dentistry and medicine's approach to health. She can provide an insightful conversation for both dental practitioners and patients. I'm really excited for this conversation. Cris, thank you so much for joining us.
Oh, it's a pleasure to be here. Thank you.
Yeah, this is such an important topic, and I think most people don't overlook it, don't really look much into it. There's many different aspects too. I mean, I don't know if we'll go into it all, kind of the old silver fillings that I had to get removed from, those kind of things like that. And there's so many different aspects of oral health that people don't even think about and realize. But let's start with a little bit of background. How did you... Obviously, I know you were a dental hygienist. Maybe tell us a little bit about your story and what you saw over the years as a dental hygienist and what prompted you to kind of make this shift.
Well, after 28 years in practice, I literally burned out. And my burnout, I came to realize at a later date, really was moral injury. And there's a difference between burnout and moral injury. And burnout, you can usually overcome by, taking some time off and going to a yoga retreat or starting meditation. But moral injury is what happens to us when we have challenges taking care of our patients according to what our values are due to the constraints of the practice, like time and the dentist focus of what he wants me to focus on, and insurance companies, and even the patient's dental IQ. All those things can impact what your quality of care can be to a patient. So when I decided, I quit my job, and then when I decided I needed to go back to work, I decided to position myself with somebody that had a different view of what he wanted for his patients. And so the first week that I was in this practice, and it's Dr. Brian McKay's practice in Seattle, and he just retired, but he took me to lunch. And he said something to me that no one has ever said before. And this was my interpretation of it. It's not exactly what he said, but I interpret it to be, he wanted me to paint a much larger canvas of who I could be for our patients in their health journey. And the challenge has been that we don't traditionally ask patients what they want for themselves. We just have them come in and sit down and say, are you brushing and flossing? How often? And have you had any changes in your general health? No. Okay. Well, I'm going to clean your teeth now. And then what generally happens is the discussion goes to, what's your favorite restaurant, or where are you going on vacation? And I just found such a huge mismatch between those questions that we were asking with traditional hygiene and what the science was telling us. So that started my journey in creating the lifeguard approach, where I could guide and guard the patient's health and wellness. And, I found almost every patient that came and sat in my chair, they were living in what I would consider the danger zone. They had multiple risk factors that could cause some catastrophic diseases and even death. And so I decided when I was going to paint that larger canvas, I was going to be the bearer of the message that I could help people get what they want for themselves. And so I started asking that question, tell me about what you want for yourself. And then that drove how I took care of them.
Wow, amazing. Yeah, this is such a common theme with so many people we've had on the show who were former doctors and were just pressured by their system to see more patients, bill more patients, 15 minutes in and out. You don't even have time to ask them questions or do anything other than, oh, here's a symptom, prescribe the medication, move on to the next one. This is what the book says to do. So it's really a pleasure when I hear about people like yourself and others who have made the shift. And I'm sure the listeners right now are wondering, and actually I'm still wondering this myself as well, so the traditional dentist, traditional dental hygienist, I mean, you just explained kind of how the conversation goes, but are there other, what are some of the biggest mistakes that you would say traditional dentists, let's say normal person like myself, I still go to actually a traditional dentist. I went to this holistic dentist to get my silver fillings removed, who was certified in some special process to make sure I didn't get mercury in my body or whatever. But for some reason, I just continued going, I'm used to this guy, my traditional dentist, go in, get my regular cleaning. What are they doing maybe wrong, or what are they missing that, through the new training that you went through with the holistic dentist is more prevalent?
Well, they're focusing on calculus or tartar. And that's a very reparative model. So you, as a hygienist, when you focus on calculus removal or tartar removal, you're literally being forced today at that appointment to pay for yesterday. So you're scraping off what's formed since they were into their last appointment. And what I chose to do was to shift that reparative model to a prepare model, where I would prepare them for health. And so I just had to figure out what I wanted and who I was going to be. Dr. McKay told me, when he said, I want you to paint this larger canvas, he also encouraged me with continuing education, the technology that I needed, and a personal coach. And so I had a mentor and I had the continuing education. And I think that's a big thing that has to happen is dentists have to invest in their hygienists, because as hygienists, we spend more time with the patient than anybody else in healthcare, than anybody. Right. I mean, we have literally 3 to 4 hours a year to spend with your patient. So why not shift what you're doing and make it count for something? Why not improve the health of the patient and give them what they want? You'll create raving fans when you do that. And so I just think that it was such an eye-opener to me when I started getting educated, that this mismatch that was there. As an example, instead of asking patients if they brush or floss, I'm much more concerned about when their gums bleed. So I would ask them to tell me about when your gums bleed, because that's what I want to know, because that is going to help me prepare them for a healthier tomorrow. So it's just a whole focus on something different. And it had great results and great outcome for our patients.
Yeah, that sounds amazing. I do. You left a little cliffhanger there. I think some people listening might want to know I mean, maybe it's not a one size fits all. I'm sure this is actually what I'm hearing from you is every patient is unique and you need to actually talk to them and understand them.
Yes.
But let's say someone, like you said, it's more of a reactive approach, just scraping out the tartar and plaque from the previous visit versus a proactive approach. So do you have any general tips for someone listening who may be thinking like, hey, how do I get more proactive versus them just cleaning out my tartar? Is there any simple tips or things I could be doing differently?
Well, we now know that there are more things that need to happen for you to be healthy other than brushing and flossing.
Mm-hmm.
And so if you can do what they call a pink in the sink test, is put some toothpaste on your brush it around your mouth like you normally do, but don't spit all the toothpaste out. Then take some soft tip picks and run those through every one of your teeth, and then spit the rest of the toothpaste out. And if there's any pink in the sink, when you do that, that means that you have some infection in your gums that is causing your gums to bleed. And then you want to follow up on that and have a bacterial pathogen test to find out which pathogens are causing this problem, because we now know that there's about 11 pathogens that work together to cause inflammation and infection, not only in your mouth that leads to periodontal disease, but also in your vascular system that causes inflammation that leads to heart attacks and strokes. So it's really important to even ask your hygienist, hey, partner with me. I want a real evaluation and the real story on the health of my mouth. And how does the health of my mouth at this point impact my risk factors that I told you about on my health history? Most people don't like to have to fill out a health history form, but it is vital to your health and wellness that you give an accurate and updated health history report when you see the hygienist, because it's all interactive. What's going on in your mouth, there's some going on in the rest of your body too.
Yeah, absolutely. And I definitely, I do want to come back and see if there's any practical tips for the listeners as well. But let's talk real quick about this connection, because I know, bacterial infection is a big thing that you had mentioned before as well. And it can cause many other issues. We've heard of this connection. I mean, you mentioned it as well in your own life, where these oral issues can cause heart issues, can cause other issues. And it's not something that many people think about. I think maybe recently there's been some talks about people who having root canals go wrong or whatever, periodontal disease causing other issues. So I think it's starting to become a little bit more in the mainstream. But what are some of the connections and things that people really need to watch out for? And also, it's the first time I actually heard anyone mention about a kind of bacterial pathogen test, did you call it, for where you can actually see what's going on in the mouth. That's interesting as well. So I imagine that's something you would do on many of your patients, especially if they're reporting gum bleeding.
Yes, it was part of my protocol back in 2006 when a dentist named Dr. Tom Neighbors launched a company that he had developed to test for these pathogens. It was called Oral DNA. And so that was the first time we really had a glimpse into finding out what was the cause of many diseases that we see going on. And the great thing is that it's very easy to do. You just swish some prepared solution and send it off to the lab, and they come back and tell you how many and at what level they are in your mouth and which ones you got and what can be done about it.
Wow, that's fascinating. Is that oral DNA? Is that still something you would recommend for people to this day if they have oral issues?
Oh, absolutely. Now, there are many companies doing these testings now because they are so important. And it was part of my protocol. Every patient that came to see me, that if I needed to do a periodontal procedure on them, like a periodontal therapy where we gave some anesthetic and did a great job of going underneath the gums and removing anything that was underneath there that was contributing to the infection, you just have to know what's causing it. And so I did that test on every patient that I saw, and it's critical. And then you also do a follow-up test after you're finished with your periodontal therapy or whatever you use to treat periodontal disease. You want to make sure that those pathogens are gone or reduced to a very low level, that they aren't causing you some problems with the infection and bleeding.
Wow, that's fascinating. That's a really good tip for people to know about.
Yeah, there's several companies doing it now. There's one called Simply Perio. There's Bristol. There's Oral DNA is still in existence. There's lots of companies, and I really believe, and I'm going to go out on a limb here, but I believe if a dentist and with his hygienist and their philosophy of care for their patient, if they are not doing testing to see what pathogens are causing the problem, it's a medical error.
Yeah. Wow.
And medical errors is the third leading cause of death in the United States at this point. It's right. Heart disease, cancer, and then medical error. Either not doing a test that should be done or doing the wrong test just to check to see what's going on. So, and so many people think, well, I don't want to have to go on antibiotics. And a lot of us are antibiotics adverse, but there are some strategies that can help without having to give antibiotics. I understand in certain cases they are recommended, but I brought in lasers and ozone into the practice, which does a great job of reducing and removing these pathogens. So there's lots of options.
That's amazing. I was just going to ask about that. And it's so funny because we just were talking about that on a previous podcast episode, how, yes, antibiotics, if you absolutely need them, you take them. But otherwise, if you don't absolutely need them, you should try to avoid them because they can weaken your immune system or different issues that people have with them. But this is great. You're bringing lasers and ozone and other things into this practice. So I'm sure we'll get into where people can find practitioners like this who are maybe trained in your ways and make sure they're seeking out the right people. Because this is all new. I've been going to a traditional dentist for years. I haven't heard any of this stuff. I've never had a pathogen test, never, have been asked these questions. Also other thing, it's interesting. I went to one dentist one time. They put this machine, I guess they had a machine that detects cavities or something now, it beeps or something. And so, I never had cavities for years. All of a sudden I go there, they're like, beep, beep, beep. Oh, you got 7 cavities or something, they tell me. I'm like, what? I go to my old dentist again. He said, no, you're good. No cavities. And it's just everything is so confusing with this stuff. So I'm going to be seeking out someone who is kind of trained in your practice and really looking for the right things here.
Well, and if there's people that are listening that have a good relationship with their dentist and would like this kind of care, have their dentist reach out to me. I love to mentor people, and my whole goal is to shift away from traditional hygiene. And traditional hygiene has put such shackles on us. It's had a stranglehold where we thought our purpose was to clean people's teeth. And it's so much bigger now. And, as a hygienist, I took an oath to advance the art and the science of dental hygiene and the care of my patients. And so we have to be mindful of that oath we've taken and live up to that. and really take better care of our patients. So,
Absolutely.
yes.
Absolutely.
Yeah.
Some common questions that I'm sure, kind of hot topics that I always get asked about myself or people. In terms of, let's say, toothpaste, are you a fluoride-free person? Do you have a preferred recommended toothpaste for people listening?
Well, you're probably not going to want to hear this, but I don't use toothpaste.
Oh, interesting. I love this. What, you got to tell
It's
me more.
really, I think toothpaste is just for taste, is to leave your mouth fresh feeling or whatever. But there are a lot of ingredients in toothpaste that I don't care about. I don't want in my mouth or in my body, like triclosan, sodium lauryl sulfate, and I don't and never really have used a fluoride toothpaste. So there's other things that
Yeah, what do you do when you brush then? I'm sure people want to know.
I use a sterilized clean brush every day, and that's what I brush. I sterilize it, and because I think one of the challenges when we're wanting to get rid of these pathogens is we brush our teeth and then we just rinse our toothbrush out and put it in a toothbrush holder or put it in the drawer. And when you're trying to get rid of pathogens, it doesn't make sense to me to go then the next day and rebrush your mouth with the same toothbrush, which probably has lots of remnants of bacteria in it. So I sterilize my toothbrush a lot.
That is such an obvious thing that myself and probably many listeners right now have never thought about. Like you just brush your teeth. Yeah, you rinse it off with water at the end. And then for me, I just put it back on my charger, the electric toothbrush, right? But it's the same thing in my mouth. I'm putting back in every day for months and months until I get it's like, this is so obvious. So how do you, and for the lay person like me who doesn't know about sterilizing things, what do you use to sterilize your toothbrush?
Well, I use boiling water.
Oh, okay.
So, I mean, some people that, if they like a microwave, you can microwave the brush. I don't know about if you're using an electric toothbrush, but you can dip the head of it in some boiling water and that'll take care of those whatever's on the brush. The other thing is to be sure and scrape your tongue.
Oh, yeah. I love that.
Get a tongue scraper, scrape your tongue, because there's volatile sulfur compounds on there that they now know that periodontal disease really doesn't happen unless there's these volatile sulfur compounds around too to add into the mix with these pathogens. So scrape your tongue and also take your toothbrush and brush the sides of your cheek and the roof of your mouth. And just give your mouth a real clean. It's not just about brushing around the necks of the teeth. You want to clean your whole mouth. So you can do that. That really helps. And I don't use a mouthwash because a lot of them have alcohol in them, and that actually promotes the growth of these pathogens. So I'm just very simple about what I use to clean my mouth with.
Yeah.
So, and
recently
some of the toothpaste that have the little tiny blue, those are plastic pieces, and you don't want those going in your body either, because there's a lot of negative effects of having plastics in your body.
Yeah, that was actually funny you mentioned that, because actually that was my only concern would be with putting a toothbrush in the microwave or even in boiling water, would be that the plastic would potentially melt or something like that. But I think taking boiling water, just putting where the brushes are, like putting the brush part in there and doing that. But that makes so much sense. That's so smart. I've been using a copper tongue scraper now for a while. Really notice a difference and feel better when using that. I did start putting the toothbrush around the cheeks of my mouth. I never did the roof of my mouth or anything like that. So that's also really good advice there to know as well. And yeah, mouthwash, definitely a no for me. I have got this like coconut oil pulling thing that has a little bit of peppermint that sometimes can give me a little fresh thing, and I'll use that sometimes. But let me ask you also then about flossing. So I've actually heard, I heard another podcast actually. I don't remember the guy's name, but he was some sort of holistic dental practitioner. And he said he doesn't floss unless he has something stuck in his teeth. But he typically will not floss because it could cause micro breaks in the gum or could cause something or whatever. I'm just curious, but most people say, yeah, you should be flossing every day, or, and how practical is it to really floss twice a day? How many people are actually doing that? What's your opinion on flossing?
Well, I floss, but it isn't to help the gums. It's to remove any plaque that's on the side of the tooth. Okay. So what I used some interdental, these soft picks that you run between your teeth. And they have little tiny brushes on them. And that helps to remove whatever's on the side of the tissue in there. So I don't, like I said, brushing and flossing isn't all you need to do anymore to keep your mouth healthy. So, pick up some of these floss picks or
so would that be
picks.
like is a water pick different, or this would be specifically a floss pick?
You can use a water pick, but you want to use it very specifically. The water pick is designed to create a flushing action. So you want to direct the tip of the water pick just straight through your teeth. Don't point it down, because that can force stuff into the gums. But, it all depends on what you like. Now, I don't use an electric toothbrush because I can't stand the vibration. That bugs me. So I spend much more time with just a manual toothbrush. And you can do that. It all depends on what you prefer and what you like to do. So.
Amazing. And what about now if someone, I guess if they notice bleeding, they should certainly go to a dentist. Why don't we just shout it out now if there's any website or training, or where can people find either you to learn more or find potentially, do you have some sort of network of practitioners that are trained in this kind of stuff that people could find in their local area?
People can email me. I welcome an email from people all the time. I believe that I'm just here. I've been left on this earth to try and help and make a difference for people. So I welcome an email. If somebody has a challenge, just give me a shout out. You can reach me at Cris, which is Cris without an H. It's CRIS at thelifeguardapproach.com. And you're welcome to email me with comments or concerns or things you agree with or don't agree with. I'm not looking for any opportunity to be offended from anybody. So just, let it out.
And I know on that website as well, on the Lifeguard Approach, you're coaching actually a lot of dental practitioners, which is amazing. I'm so happy you're doing that. The more dental practitioners that are following these practices, the better. And then you also have something specifically for, let's say someone, it's so confusing, and you hear all these horror stories. And next thing I wanted to ask you about actually was like root canals and these periodontal diseases that cause these major issues that we alluded to earlier in people's health. But it's also so confusing. Like, who do I go to? This guy says I need a root canal right now, and then it's like I heard of all these problems, and the holistic dentist is telling me something different. What's your opinion on all of that? And if someone has a serious issue like that, they can reach out to you for some potentially, coaching or advice there?
Well, I think you have to really listen to the science and, follow the advice of your dentist. And I think you just have to really be discerning about who you go to, what their beliefs are. And, I really believe that the root of all the problems are in the pathogens that are in our mouths, and identifying those and getting rid of those is the key to your health and wellness. We got to balance the biofilm. We can't get rid of the biofilm because it does, we have more bacteria in our mouths and our bodies than we have anything else. But we've just got to balance it and create a healthy biofilm. And, I'm not here to tell people whether or not to have a root canal or, because there's a lot of controversy. The controversy now going on is about fluoride. And so I think you have to really establish a great relationship with your dentist and make sure that your dentist and hygienist, that your health and wellness is their number one concern, and that they educate you on what the science is.
Yeah.
And
yeah,
go
and
from there.
I think the challenge for most people will be finding that right dentist in their area. That's why I hope you continue to train dental practitioners, and I hope maybe on your website you can create a directory of all the people who have gone through your training, or if someone contacts you, maybe that you can help them find someone in their local area. Yeah.
Yes, I probably can do that. I'm going to start another section on my website that is for patients, and with this kind of information on it. In the meantime, what I'd recommend that people do is go to a website of a mentor of mine. His name is Dr. Bill Domb, D-O-M-B, and he has a website called Z, as in Z or zebra, T, the number 4, BG.com. And it stands for Zero Tolerance for Bleeding Gums.
Wow.
And so that is your indicator. If your gums are bleeding even a little bit on occasion, particularly if you're using the floss or the floss picks, or even when you brush, you need to see somebody and find out what pathogens are driving that infection. It's different for everybody. A lot of this depends on the host response, how your body responds to pathogens, and what your innate immune response is. So, but man, if you've got bleeding gums, and ask your hygienist to pay particular attention to the evidence she sees clinically that can lead to disease, illness, and even death. So you want somebody that is right on top of and informing you about what the science is and what we now know, as opposed to one that just sits and chats and polishes and you talk about your next vacation. That doesn't fly anymore.
That's right. That's right.
And
I'll tell you.
Go ahead.
Yeah, I was just going to say, for me personally, based on what I've learned from you today, one of the main things is if I ever found bleeding gums, I would, first of all, I'd contact my dentist and say, do you regularly do, or can you provide a pathogen test, right? And if they say no, I'm probably going to look for another dentist who does provide this pathogen test. That's probably my step one. And then if the pathogen test tells me I have a certain bacteria, I am much more likely to go for something like what you mentioned, which is some sort of alternative laser therapy or ozone therapy to try to get rid of the pathogen versus, again, are there people who are just, unfortunately, this is a business for many people. And it's like, is someone doing a pathogen test so they could show you that you have this bacteria so they could say, okay, now we need to do this procedure on you, or, do something where they make money off of it, which again, I have some potential issues with, obviously, something like that. So I think finding someone who not only can administer the pathogen test and provide me with the results and discuss it, but also someone who maybe has some approaches to tackle it the way that you do with the lasers or the ozone.
But I would even encourage people, even if you aren't having bleeding, but you're very concerned about your health and wellness, get a baseline pathogen test run. And remember this, do you know how we transmit these pathogens from one another? There's 3 ways.
Okay.
Mothers, lovers, and dogs. So the last thing you should be doing is letting your dog lick your face or let your dog lick off of your spoon. Believe it or not, there's people that do that. And then the other thing is you may be in a great shape, but you start a new relationship with somebody, and down the road a ways, you might start having a little bit of bleeding. We swap saliva in certain activities that we do. And so you have to be really careful about the health and wellness of any partner that you choose.
That is fascinating. That is really, really interesting. Yeah. Stop making out with your dogs, people. You know who you are if you're listening right now.
Yeah. And especially, when I said mothers, as mothers, we transmit these pathogens to our children. I've seen multiple times when we were raising our son, that when I'd be around other mothers, the child would drop the pacifier and the mother would pick it up and put it in her mouth and clean it and then put it back in the baby's mouth and or test the temperature of the food on the spoon and then feed it to the child. So you really have to be careful about your routes of transmission that you can be involved in.
Yeah. Real quick, one last question on the pathogen test. Is that something that I can order myself, like from a website, and do it on my own, or do I have to go through my dentist for that?
Well, I think there is. Are you familiar with Life Extension?
Yeah. Mm-hmm.
Well, I did a podcast with them, and at the time, one of the companies was getting in the position where they were going to offer their tests through Life Extension. But I don't know if that has gotten any traction or what's allowed to do it. But also, I was just on a podcast yesterday with a functional practitioner in England, and he does pathogen tests on his patients, and he sends them to a dentist that isn't doing pathogen testing. So I was like, I think it's time this dentist starts pathogen testing as well, the rest of his patients. So
that's right.
Yeah.
That's great.
I think you can.
Okay, I'll look it up. Yeah, I'll search for at-home oral pathogen test and see if I find anything.
Like I said, a couple of the names of one that are very user-friendly is called Simply Perio. Another one called Bristol. And then, of course, there's the original Oral DNA company. And it's called oraldna.com.
Amazing.
Yeah.
Amazing. Who specifically should reach out to you then? You provided your email address. Your website is thelifeguardapproach.com. Who should be reaching out to you?
Well, anybody that has a question, if there's a dental patient on here that would like to get their dentist into the new century of patient care, I'd love to hear from them. I'd love to help and mentor them. And patients, if you've got a question that you've just been dying to know the answer to and you haven't had anybody answer it, well, let me know. You see, my big purpose and focus on how I took care of patients was to do and be able to do life-saving screenings. And the big pushback that hygienists and dentists give is we don't have time, because I'm so busy scraping calculus or tartar off of people's teeth that I don't have time to do these life-saving screenings. The wonderful thing about when you prepare patients for health by doing an effective reduction and removal of the bacterial load in somebody's mouth to prepare them for a healthier tomorrow, I stopped seeing tartar. My patients were coming back to see me in great shape. And they knew if they had any bleeding that started, they knew they needed to give me a call because something had changed. But what it did, it gave me the opportunity to do life-saving screenings like oral cancer screenings, blood pressure. There's probably 5 life-saving screenings that were really important to do on chairside. I mean, oral cancer screenings are a must. They must be done on every patient every time you see them.
Wow.
And it's not being done.
How do you know how do you know if your dentist is doing it? Will they say, I'm doing is that a different way that they need a machine or something to screen for that? Or is it just a normal checkup?
I did a visual and tactile oral cancer screening. You know, you stick your tongue out, put your tongue on the roof of your mouth. They feel around and they palpate around your neck. They're looking for any lumps or bumps that don't belong there outside of your mouth. But inside, they're looking for any kind of lesion that doesn't belong there. And if it's been there for more than 2 weeks, you got to have it checked out. Mm-hmm. I was the first hygienist in private practice in the United States to have what's called a Velscope. And it uses tissue autofluorescence to illuminate areas that could possibly be a problem.
Wow.
And so the technology that I used became lifelines for our patient. My second patient when I was in hygiene school was my husband's grandfather. And I found an area on him that turned out to be oral cancer.
Wow.
And what I realized was that every person that sits in my chair has a plethora or a community of people that love and care about this person, just like I loved and cared about my husband's grandfather. So I made a decision that day, my second patient in hygiene school, I was going to do an oral cancer screening on every patient at every visit without fail. Because I knew, it's sitting right out there. We don't have to do any huge, tests to prepare to look for oral cancer. And there's a different player in oral cancer now, and that's the HPV-16 virus that causes cervical cancer. Causes HPV-16 related oral cancer. And on my website, you can see there's a continuing education course that I did that talks about you have to do a little bit different of an exam for HPV related oral cancer than just your tobacco and alcohol related oral cancer screening. But yeah, if you're not getting an oral cancer screening every time you go in there, there's something wrong. Their focus is on the wrong thing. It's not on saving your life. It is on removing tartar. And we have never had anyone die from a tartar infection.
Wow.
So,
I'm wondering, I've never heard any dentist ever mention to me, oral cancer screening we're going to do on you. Maybe they're doing it and they didn't tell me or something, but do you even think that most traditional dentists know how to look for this? Forget about if they're actually looking for it, but if I asked them, hey, can you do an oral cancer screening, would they even know what to do?
Well, I think they probably would.
Good.
But, I'm just dedicated to doing the best I can for a patient. It's all about the patient. It's not about me. I work for the patient when they came and sat in my chair. And let me tell you a little bit of the backstory about why I think why I've identified why my perspective is like it is. When I was a 14-year-old, I was a competitive swimmer, and I was really good. I won every race that I ever swam. I swam a race at my home pool one time, and when I finished the race that I won, I turned around and leaned against the back of the pool and waited for the other swimmers to finish, and I blew a great big bubble. I swam that race with 3 pieces of double bubble gum tucked underneath my tongue. And what I didn't notice, the lifeguard got down off her perch, who I knew, and the timer in my lane was a physician that I knew. And they stopped and asked me a question that changed the course of my life. They asked me, "Do you want to live to be an adult?" And at that particular time in my life, my parents had buried 2 of their sons. 2 of my brothers had died from childhood accidents. And I could not bear the thought of someone having to go home and tell my parents, "We're sorry, but you need to bury your 3rd child." And so I became a risk management warrior at that time in my life. And I did carry that on through hygiene school, like I said, about oral cancer. But then when I learned the new science, I became even more of a risk management warrior. And what I did and what I do is I take somebody's risk factors from their health history and I overlay over that what their values are. Because I ask very different questions. So instead of a hygienist would say, now normally as we're walking back to your hygiene operatory, tell me about a vacation you took this summer. I don't want to know all that stuff. It doesn't matter to me. But what matters to me, I ask them the question, tell me about something great in your life. And it's never been they've taken a big check to the bank or anything to do with that. It's always, my first grandchild was born a week ago. My wife has been cured of cancer. My kids are moving back to the area. So what I'm able to do is in my message, and when I talk to them, I say, because you're so excited about this new grandchild and you want to see this grandchild grow up, here's what I'm going to recommend that you do because of these risk factors that you have. We can mitigate these risk factors with your values. And
Amazing.
That's why people make the choice to do what I recommend as far as their health and wellness goes. And that's what I call guarding and guiding the health and wellness of our patients.
That's amazing. I think that's a great place to end it. Cris, this has been really eye-opening. I've learned a ton. I know people listening have learned a ton as well. People should check out thelifeguardapproach.com. I think you mentioned your email, if people have questions, is Cris@thelifeguardapproach.com, with Cris being spelled CRIS. And that's very generous of you to give your email like that and allow people to ask you questions. I'm sure you've already helped so many people and saved so many lives, and really want to thank you for spreading this information. And highly encourage people to recommend your dentist and dental hygienist, forward them this podcast maybe, or send them Chris's website. And the more people we have trained, in this kind of work, the better we'll all be for it. So thank you for everything you do, and I hope we can do this again sometime.
Absolutely. Anytime, Talur. I'd be happy to. Thank you.
Thank you. Thanks for listening. If you enjoyed the episode, can you please leave us a rating or review and subscribe? I've realized that while we have actually increased our downloads a lot, we're actually getting a lot of downloads, which I'm really happy about. We actually have very few ratings. And I realized that I've never asked people really to rate much. So I'm asking you now if you could please rate and review and subscribe. And if you enjoyed the episode, please forward it along to anyone that you think will get value out of this. Also, if you haven't checked out our line of products at buypeakperformance.com, you get 20% off your first order. That's www.buypeakperformance.com. We have some incredible products, including our organic high-altitude coffee. If you don't know this, coffee is one of the most heavily sprayed with pesticides out of any crop. So it's really important that you drink organic coffee. We've gone above and beyond to source what we believe is the highest quality and healthiest organic coffee in the world. We're also famous for our organic green superfood powder. You can get 20% off of that as well at buypeakperformance.com. We also have an organic vegan and paleo plant protein. See, most of the vegan proteins out there are using brown rice protein, which is really not a good source of protein, and it's also a grain. And if you're paleo, you know that grains tend to cause inflammation in some cases for some people. And so we wanted to make one that was paleo friendly and vegan and organic. We made an amazing amino acid profile, so it's really one of the best plant proteins for muscle building. So you can check out Peak Performance Organic Plant Protein. You can find that on our website. Of course, all our products are on Amazon as well. So thanks again. And again, please, if you enjoyed the episode, please forward it along to someone who you feel can get value out of it. And please leave us a rating, review, and subscribe. Thank you.